Increasing physical activity during weight loss increases the total energy expenditure, and it reduces the drop in resting energy expenditure that's triggered by calorie reduction and weight loss. When combined with reduced calorie intake, aerobic exercise has been shown to increase the likelihood of both short and long-term weight loss. Exercise has also been found to help to preserve muscle mass, promote fat loss, and improve appetite regulation. Furthermore, exercise is a critical part of a healthy lifestyle, and it supports metabolic and overall health. It reduces the risk of chronic diseases like obesity, type 2 diabetes, cardiovascular disease, and some cancers, and it extends lifespan. In fact, a lack of physical activity has been estimated to be responsible for twice as many premature deaths as obesity. Of course, diet and lifestyle changes work best when used together. In a randomized control trial of 147 overweight adults with type 2 diabetes, it was shown that an intensive lifestyle intervention, which included changes to the diet and physical activity and structured lifestyle support, was more effective than the usual medical care at reducing body weight, improving the glycemic control, and inducing the remission of type 2 diabetes. The lifestyle intervention included low-calorie meal replacements in the first phase, followed by a gradual reintroduction of food, plus exercise and lifestyle support. Participants in the intervention group lost over 3 times as much weight as those in the control group during the 12 months of the study. In addition, 61% of the participants in the intervention group experienced remission of their diabetes, compared with only 12% in the control group. The intervention group also had better glucose control. It's advisable for people who are overweight to consider implementing both dietary changes as well as physical activity regime. Sticking to an exercise regime long-term is a major factor for sustained weight loss. Therefore, it's important to choose a type of physical activity that's motivating and sustainable. In order to contribute to sustained weight loss, exercise needs to be mainly aerobic, but of at least moderate intensity and an average 4 to 5 hours per week in duration. Time spent exercising is cumulative, and therefore it's beneficial even when performed in multiple bouts lasting at least 10 minutes. Attention has focused in recent years on high-intensity interval training as a time-efficient way to achieve the benefits of exercise. Most high-intensity interval protocols involve exercising at greater than 90% of the maximum heart rate for repeated short bouts of 1 to 5 minutes, with a rest or a low-intensity activity several minutes between the bouts. High-intensity interval training has been found to reduce the total and visceral fat mass, even without weight loss. This is important because fat mass, particularly visceral fat mass, is more closely associated with heart disease than the BMI. High-intensity interval training appears to be as beneficial for metabolic health as regular exercise, but has greater effects on fitness. A meta-analysis of 18 studies comparing high-intensity exercise, including high-intensity interval training, to regular exercise programs involving moderate intensity activity for longer time periods, found the high-intensity exercise had the same effect on the BMI and the waist circumference, but resulted in greater reduction in the percent of body fat than regular exercise. In addition, high-intensity interval training led to more improvement in cardiopulmonary fitness than regular exercise. One of the greatest challenges faced by people trying to lose weight is dealing with food cravings and emotional aspects of eating behaviors. Stress, depression, and anxiety, as well as external food-related stimuli, such as advertisements and ubiquitous food placement, conspire to create a virtually irresistible desire to eat. Differences in neurocircuitry in people who are overweight and obese might further add to the difficulties controlling food choices and eating behavior. Stress management and cognitive behavior therapy, therefore, can potentially be important in successful and sustained weight loss. Mindfulness-based stress reduction is a validated 8-week stress management program based on cultivating awareness of the present moment. In uncontrolled research, it reduced self-reported emotional eating, binge eating, and eating in response to external cues. In a controlled trial, subjects who participated in a program teaching mindful eating and prolonged chewing lost more weight, engaged in less emotional and cue-stimulated eating, and reported fewer cravings compared with matched counterparts placed on a waiting list. Cognitive behavior therapy, a form of psychotherapy based on developing strategies for coping with unwanted or unhelpful thoughts and behaviors, is another option for managing the psychological aspects of weight loss and eating. Cognitive behavior therapy has been found to improve weight loss, increase restraint in eating, and reduce emotional eating and binge eating in clinical studies. Cognitive behavior therapy may also help to decrease the likelihood of weight regain after bariatric surgery. For more, continue on the weight management series, or for information on herbs, supplements, and natural treatment plans, check out my website.